Hello and welcome. Today we're shedding light on a condition called vesicovaginal fistula or VVF. This is a challenging health issue that primarily affects women, and understanding it is crucial for promoting better health outcomes. We'll explore what VVF is, its causes, how it affects the body, its symptoms, diagnosis, treatment, and what can be done to prevent it. So, what exactly causes a vesicovaginal fistula? The primary cause, especially in developing countries, is prolonged obstructed labor. This happens when labor is difficult and prolonged, putting excessive pressure on the tissues between the bladder and vagina. The sustained pressure cuts off blood supply, leading to tissue death and ultimately a fistula. Other causes can include surgical complications, such as after a hysterectomy, radiation therapy for pelvic cancers, trauma, and rarely, certain infections or advanced cancers affecting the pelvic region. Now, let's delve into the pathophysiology. A vesicovaginal fistula is essentially an abnormal connection, a hole between the urinary bladder and the vagina. This hole allows urine to leak continuously and uncontrollably from the bladder into the vagina. This constant leakage causes skin irritation, infections, and significant emotional distress. The tissues surrounding the fistula are often inflamed and weakened, further exacerbating the problem. Long-term, it can lead to kidney infections and even kidney damage if left untreated. While precise global figures are difficult to obtain, vesicovaginal fistulas are significantly more prevalent in low-resource countries, particularly in sub-Saharan Africa and South Asia. Factors contributing to this higher prevalence include limited access to quality obstetric care, early marriage and childbirth, malnutrition, and poverty. In developed nations, VVF is less common and typically arises as a complication of surgery or radiation. The signs and symptoms of vesicovaginal fistula are usually quite obvious. The most prominent and distressing symptom is continuous and involuntary leakage of urine from the vagina. This leakage is often accompanied by vaginal irritation, skin breakdown, urinary tract infections, and a foul odor. Affected women often experience social isolation, depression, and a significant reduction in their quality of life due to the persistent wetness and odor. Diagnosing a vesicovaginal fistula involves a thorough pelvic examination. The physician will visually inspect the vagina and surrounding tissues. Dyes such as methylene blue can be instilled into the bladder to see if they leak into the vagina, confirming the presence of a fistula. Cystoscopy, a procedure where a small camera is inserted into the bladder, can help visualize the fistula and assess its size and location. In some cases, imaging studies like a CT scan or MR may be necessary to evaluate the extent of the fistula and rule out other potential causes. Vesicovaginal fistulas can be classified based on their size, location, and complexity. Some common classifications include simple fistulas, which are small and easily accessible, and complex fistulas, which are larger, located near other organs, or associated with significant tissue damage. The type of fistula influences the choice of treatment approach. Treatment for vesicovaginal fistula almost always involves surgical repair. Smaller fistulas may be repaired vaginally, while larger or more complex fistulas often require abdominal surgery. The goal of surgery is to close the abnormal connection between the bladder and vagina, restoring normal urinary continence. In some cases, a temporary urinary catheter may be placed to allow the tissues to heal properly. Post-operative care is crucial to prevent infection and ensure successful healing. In certain situations, conservative management with bladder drainage may be considered as a temporary measure or for patients who are not suitable candidates for surgery. This includes use of a Foley catheter, which drains urine into a bag, allowing the VVF to resolve on its own but has a low success rate. Prevention of vesicovaginal fistula is paramount and focuses primarily on improving access to quality obstetric care. This includes ensuring that all women have access to skilled birth attendants during labor and delivery, timely access to cesarean sections when needed, and adequate prenatal nutrition. Educating communities about the dangers of early marriage and the importance of delaying childbirth can also play a significant role in prevention. Addressing poverty and improving overall health infrastructure are also crucial long-term strategies. The prognosis for women with vesicovaginal fistulas is generally good with successful surgical repair. Many women experience complete resolution of their symptoms and can resume normal lives. However, some women may require multiple surgeries, especially for complex fistulas. Recent research is focused on developing less invasive surgical techniques, improving surgical outcomes, and finding ways to prevent fistula formation in the first place. Further advances in tissue engineering and regenerative medicine hold promise for future treatment options. With access to appropriate medical care, vesicovaginal fistula is a treatable condition, offering hope and restored dignity to affected women. Thank you for joining us today.